I think you have similar programs, not exactly the same, but in other countries. Because there's a key element is that they said WHO has some estimate that between 25 to 50% of patients are not compliant, don't adhere to the treatment. So it's an element to make sure that whenever a box is provided to the patient, whenever medicines are provided to a patient, then really the patients take them appropriately. So then they benefit from better health. In most cases also, the government has not always clearly defined the expectations towards pharmacies and pharmacists. What they do is usually they say in the law what pharmacist is allowed to do. But there has never been a clear understanding what do they want from pharmacies and pharmacists. And so in some countries, like in Australia, they have 1.5 billion Australian dollars over 5 years for services of pharmacists. And that is because they have defined objective with the profession and the government. So what we see that pharmacists are more and more involved, not only in the dispensing, that's always an important part of our activity, but also in terms of acting as an entry gate to the healthcare system. It means acting and doing pharmaceutical triage, so then we can refer back to the doctors when needed or ensure the treatment. So that's in a more formalized way, but also ensuring that the medicines are properly used. That could be through adherence support, that could be through helping medical doctors and other prescribers to be better in their prescriptions. So then eventually the investment made by the government really result into better health outcome. Yes, one key finding we have in many reports is that pharmacist competencies have been underutilized, meaning that we have a lot of competencies that we are not yet using, and a few reports, including for instance from IMS Health, state that the pharmacist is one of the strongest solutions for improving the responsible use of medicines.